In the last video, we have discussed about the leukoplakia and erythroplakia. These were the whitish or reddish pearly plaques developing on the mucosa of oral cavity. Suppose these changes are developing on lower lips, gingiva, tongue, soft palate and the floor of the mouth. But when we take the biopsy of this patient, we found these are not leukoplakia and erythroplakia. This time it is the squamous cell carcinoma of oral cavity, the most common carcinoma. Welcome to the new video of Animo. Now let's talk about the gross features of this squamous cell carcinoma. It is divided into two stages, the early stage and later stage. In the early stage, there is pearly plaques or mucosal thickening which happen because of leukoplakia and erythroplakia. In the later stage, the dysplastic cells in this leukoplakia and erythroplakia progresses into four morphological patterns. So here are these four morphological patterns of squamous cell carcinoma. Number 1, the ulcerative type. It is the most common pattern seen in SC carcinoma. It looks like rolled and raised edges with a center of indurated ulceration. Number 2, papillary type. These form the papillary finger-like projections. This is soft and papilloma wart-like growth, and it looks like this. Here you see these are finger-like projections. Number 3, the nodular type. So it forms something just like nodules, the round thickening and a raised mass. So this is firm, slow-growing submucosal nodule. And number 4 is squamous type. It is actually the most alarming subtype because it grows not above the surface but below the surface, just like this. So here is a gross picture of ulcerative pattern of squamous cell carcinoma. Now as for the microscopic features, it have a range from well differentiated epithelial cells with keratinization, which is a normal squamous cell epithelium, to the dysplastic undifferentiated epithelial cells with poor keratinization, and all these changes have dysplastic cells and keratin pearls. So this is a histological illustration of squamous cell carcinoma histology. This is a surface keratin layer. This may be present or may not be present, as I have discussed. These are the dysplastic cells. You can see these cells don't have a head or tail, so they lost their polarity, and these cells have prominent large nucleus with prominent nucleoli. And here you can notice the growth pattern of these cells is not regular. So these are the dysplastic cells of squamous cell carcinoma, and this is the basement membrane, and below you can see these are the keratin pearls, which is found only in squamous cell carcinoma, and there may be the lymphocytic infiltration in this carcinoma. Now let's compare it with the histological slide of squamous cell carcinoma. Here you see this is the keratin layer. This is the stratified squamous epithelium with dysplastic cells. And here you see these dysplastic cells have grown to so much extent that they invade the basement membrane and grows into the submucosa. And here you see these are the keratin pearls. So this concludes the section of squamous cell carcinoma, the most common carcinoma of oral cavity. See you next time.